Health Assessment PA2 Return Demonstration.
Come in.
Good day, dear. By the way, I'm B. Cañadora, student nurse from Asian College of Technology, and I will take care of you from this day. For safety purposes, may I hold your hand so I can check your ID number. Okay, dear. By the way, dear, I am here to do an assessment in regards to your upper extremity, both your breast, your lungs, your heart sound, etc.
After that, you should provide clients privacy. Next, you should perform hand hygiene. After that, inspect breast for size, shape, and symmetry in sitting position. Inspect for relus size, shape, symmetry, color and visible lesions and mass of the client. Next, inspect the client's nipple and palpate breast, areola and nipples for masses, tenderness and discharges.
Here in doing the heart examination, I'm going to place you in a proper position, okay?
Inspect for any pulsations on anterior, chest over heart, and palpate for any pulsations or the apical impulse. After that, auscultate the heart rate and rhythm. Next, inspect the jugular veins for distension while the client is placed in the semi-Fowler's position 15 to 45 angle, with the head supported on a small pillow. And if jugular distension is present, assess the jugular venous pressure GVP. Next, inspect skin color, presence of hair, moles, wound, skin breakage, scars, etc. Next, inspect for the size, shape, and symmetry of anterior thorax. Then, palpate for lumps, mass, and areas of tenderness. Next, observe for symmetry and position. Palpate the skin and tissue over the scapula for signs of swelling or tenderness and signs of dislocated bones. Next, note for symmetry of the thorax from posterior and lateral views, rib structure and movement. After that, palpate the skin over anterior thorax. Next, do pinch test at back of the hands. After that, inspect and palpate anterior chest for respiratory excursion, thoracic expansion.
Okay, dear, when I place my both hands in your chest, you need to say the word 99, okay?
99.
Raise your hand here. Say 99. Okay, dear, I'm going to auscultate your chest. All you have to do is say again the word 99. When I place this diaphragm in your different side, okay? Do it again. 99. Here, next I'm going to auscultate again your chest. All you have to do is you need to inhale and exhale when I'm going to place the diaphragm in your different side of your chest, okay?
Chest wall percussion notes. After that, inspect for the size, shape, and symmetry of the posterior thorax. Next, note the position and alignment of spinal. Next, palpate for lumps, mass, and areas of tenderness. Next, assess symmetry and movement upon breathing. Next, note for symmetry of the thorax from posterior and lateral views, rib structure and movement. Next, palpate the skin over posterior thorax. After that, inspect and palpate posterior chest for respiratory excursion. Tactile fremitus. Vocal fremitus. In assessing breath sound, auscultate posterior thorax using the flat disc diaphragm of the stethoscope. Abdomen inspection. Observe skin color, vascularity, and contour. Next, auscultate bowel sounds. And lastly, palpate the client's abdomen. Then document findings in the client record.